Dr. Omar Mubarak, Managing Partner of the Vascular Institute of the Rockies. Welcome on the Business Brief.
Thank you very much for having me. I'm excited to be here.
You and your colleagues operate the largest vascular surgery group in Colorado, for that matter, in the Four Corners. Tell us more and how things are going.
So our business, Vascular Institute of the Rockies, is doing very well. We're a group of 7 board-certified vascular surgeons. We have clinics that are permanent in Denver, Aurora, and Wheat Ridge. And we have outreach clinics in Alamosa, Avon, Kansas, and Steamboat. We've also got locums coverage in Grand Junction and Greeley. So we've been expanding a lot over the last few years and working very hard to try and deliver the best vascular care that we can to multiple communities throughout the state of Colorado. But what I'm most excited to talk to you about today is our new venture on Florida and Colorado Boulevard. We are creating not only a medical office building, but it's a medical office building that functions both as an office-based lab and an ambulatory surgical center. So we can switch designations depending on the day. And an ambulatory surgical center, there's lots of ambulatory surgical centers throughout the state, but this is the first cardiovascular ambulatory surgical center and OBL. And what we can do is switch our designation depending on the day. And we should be able to cover all types of cardiovascular care, including cardiac, vascular, and interventional radiology.
Now, first and foremost, you're a healthcare provider, but you also have to know the business side of medicine. As you mentioned, you guys are opening up this new venture, and it's a game changer, combining office-based lab with an ambulatory surgical center. Tell us a little more about what's behind the expansion.
Sure. So the reason why these office-based labs are starting to occur across the country is that CMS basically started to allow people to bill for a lot of procedures that are done in the arteries and veins. And that's a process that's been going on for decades in a way. For example, when you talk about like a laparoscopic cholecystectomy, back in my dad's day when he was doing that surgery, it was done in a hospital. But nowadays, that's a routine procedure that you can get done in an ambulatory surgical center. So the government is purposely opening up where procedures can be done in outpatient facilities. And that's in order to save money for the consumer and for the payers, with the hopes that, if the payers save money, then more money can be put to delivery of more healthcare.
So let's break this down a little bit more. And lowering the cost of healthcare is something just about anyone and everyone who has to consume healthcare wants. The Colorado Department of Public Health has estimated $8.2 billion in annual costs associated with cardiovascular disease in Colorado in 2020. Nationally, hundreds of millions of adults have gotten cardiovascular disease, which requires very expensive procedures in the hospital. By moving this type of care from the hospital to an outpatient setting, you believe that this could cut costs by as much as 30% while preserving the quality of care. Do you believe this is where healthcare needs to head?
Yes, I do. So, those stats are true. A person dies of cardiovascular disease in Colorado every hour. Just to put the magnitude of the problem. So cardiovascular disease includes coronary artery disease, peripheral arterial disease, and cerebrovascular disease. Coronary artery disease is disease in the arteries of your heart. Peripheral arterial disease is disease in your lower extremities usually. And then cerebrovascular disease is disease in your carotids or intracranially. And so with that number of people having cardiovascular disease of some sort, and literally one person dying of it every hour in the state of Colorado, it is our most burdensome chronic disease that we are having to pay for as a society. And There have been many papers published in the Journal of Vascular Surgery. One of them, for example, by Dr. Jane, who was one of my mentors at Michigan State University, where they've shown that by moving into these types of centers, you can keep the quality very high on several metrics, including patient satisfaction, mortality, and lower infection rates. And at the same time, save money. So for example, in the article I was talking about from Dr. Jane, there were 3 vascular surgeons who over just the course of 2 years had saved the healthcare system over $1 million. And so you could see how a group like ours, which is working, very diligently on cardiovascular disease, along with a group of cardiologists and radiologists, could easily cut costs substantially for the state of Colorado. And, it is just like the analogy I gave you before, where I said you used to do a gallbladder inside of a hospital, but now you do it in an outpatient facility. I actually believe that even large-scale vascular surgeries over time, a lot of them may migrate into this outpatient arena, especially because the technology gets better and better, and we're able to do it in a minimally invasive fashion. And vascular surgeons are actually becoming more and more minimally invasive with their endovascular techniques.
Well, I think you just underscored why this is so important in Colorado. I even hear the mayor of Denver and the governor of Colorado are coming out to your grand opening, which I think says a lot about how big a deal this is and a game changer for Colorado's healthcare landscape. Dr. Omar Mubarak, Vascular Institute of the Rockies, thanks for joining us on the Business Brief. We wish you and your team and partners, and most importantly, your patients, success in the months and years ahead.
Thank you very much. Thanks for having me.